Welcome back. Today, we are talking about the research happening right now to better understand women as they age after menopause. One group leading that charge is the Women's Health Initiative. Their goal is to understand how lifestyle, medicine, and biological factors really affect aging and diseases. To talk more about this, we've got Dr. Dana Bitner in studio with us. This has kind of been a hot topic. The WHI recently had their federal funding reinstated. So let's begin with talking about maybe why it was taken away in the first place and why it's so important.
Right. Well, I think number one, there's just been so much conversation about government funding and what's going to be funded, what's not. And this is just so important to talk about. So unfortunately, the funding was cut, the study was stopped, and because of public outcry, it was reinstated.
Okay, so the good news is that this important research will continue. What exactly are they tracking to help women?
So it's so interesting. It's an observational study, meaning they're watching what happens to women as they age, whether or not they take hormones or they don't, whether or not they have risk factors for heart disease or don't. And so it looks at how they age and what we can understand about what really is important. Is it important to look at cholesterol? Is it important to look at weight training? So a lot of this we know, right? But it's to see these women as they age. There's people in the study who are over 100.
Wow.
So we're learning a lot. It's a really critical study.
Yeah, and also talking about the diseases that women commonly are diagnosed with and maybe how to prevent having these diseases.
So it's looking at ovarian cancer. It's looking, again, cardiovascular disease, stroke, dementia. Like, what are the factors that matter? And again, like you say, what can we do to prevent? So the study is super important. It's helped us so much with hormones to know who can take them, who can't, when do we start, do we have to stop? So we now know that hormones don't cause breast cancer. They actually, women who take estrogen alone have a reduced risk of breast cancer. So we've learned a lot, and if it weren't for that study, we would be kind of swimming blind.
Right. So important, obviously, to do this research, important to talk about it as well.
It is. And it's so important to think about, you know, what can we do? You might not have thought about research in the past, but what could you do? So number one, if you choose to donate to such, you know, organizations, to donate to groups that do research in areas that you're concerned about. If you had a parent with dementia, would you donate to that and really make sure that these organizations do well with the money. Number two, you could participate in a study, right? So even here at Banff in Grand Rapids, at Michigan State, at Corewell, there are a lot of opportunities to be involved in a clinical trial. If you are healthy, they need healthy volunteers to compare to people with disease states.
Right.
Or if you have diabetes or heart disease, how could you participate?
Okay, do we need to talk about Jane this week?
Let's talk about Jane. So Jane, her mother had breast cancer, and she really wanted to participate in research and also understand for her what her risk factors were. She really wanted genetic testing, but it wasn't in the budget and insurance wouldn't pay for it. And so she enrolled in the study called the Wisdom Study, which has been really exciting, centered in Chicago. And it really looks to see how can we screen women for breast cancer. Do we just use a mammogram? Do we use ultrasound? And with the Wisdom Study, there's genetic testing involved, so she got her genetic testing done. She found out she did not carry the gene, but had a clearer path about how to monitor. So she learned as well as helped other women.
Yeah, we all have women in our lives. So glad to hear this research is happening. Thank you so much for always bringing awareness to these topics as well.
Thank you.
Dr. Bitner, thanks so much for your time.